Hi, Jill.
Hi.
I'm curious to know how you got interested in the Oral Cancer Foundation and oral cancer screenings in the first place.
Really, the biggest thing that prompted my interest was seeing the effects on my patients. What the Oral Cancer Foundation provides support that is really lacking for people.
What was it like in hygiene school? Were you educated about oral cancer screenings?
We were taught how to do them, but not like we should. It was really presented more as oral cancer was a rare thing, and then if something would basically jump out at you, then, to make sure that you investigated further. But it wasn't stressed that it needed to be consistent for every patient, whether we thought they were at high risk or not. Back in those days, was considered the year older, heavy drinking, smoking male.
Not people who look like me.
Exactly. It's very difficult for dental professionals in the beginning because you go from a school setting where you're given, sometimes 2 hours for a patient. And when you get out into a dental practice, you're lucky to get an hour. There's so much to fit in during that time. What is it that I need to cut out to make this work? And unfortunately, oral cancer screenings many times is one of the things that falls by the wayside.
How do you recommend hygienists squeeze in the oral cancer screening when they've only got 45 minutes?
Really just needs to be part of your routine. What really helped me to fit that in was to always be educating the patient during the process. I'm talking to them the whole time as I'm feeling, as I'm looking. I tell them what I'm looking for. I tell them what they could be looking for at home. It's not unusual that we're going to have abrasion, a red spot, a lump there somewhere. But if something lasts for over that 2-week time, that is when it needs to be investigated more.
And then 2 weeks go by and I happen to say, wow, I still have this thing in my mouth. I better get back in to see my hygienist.
And that's our opportunity to have some documentation made and to decide, is this something that we can investigate more on our own, or does it need to go to a specialist and refer to an oral surgeon, or we refer to an ears, nose, and throat doctor?
But obviously you want refer to somebody who really has experience in recognizing what oral cancers look like, right?
I think there's such value for dental practices to have some collaborative relationship made with other health professionals in their area, provide their patients with the best care possible.
That's really good advice, Jill.
And don't wait for the need to arise and then be scrambling to find these relationships. Make sure that this is established ahead of time.
Love it. Thank you for your advocacy and for your work in raising awareness.
Thank you, Eva.
Bye.
Bye.